If a fountain of youth really existed, it would start with good sleep. As we age, sleep becomes more and more valuable. When we sleep well, we're able to be more present, energized, and actually enjoy our lives when we're awake. This presentation is designed to share how your mouth tells a story about your sleep. This short clip from Matthew Walker, a sleep researcher at UC Berkeley and author of Why We Sleep, explains the importance of sleep.
My name is Matthew Walker. I am a professor of neuroscience and psychology at the University of California, Berkeley, and I am the author of the book Why We Sleep. We certainly know that a lack of sleep will actually prevent your brain from being able to initially make new memories. So it's almost as though without sleep, the memory inbox of the brain shuts down and you can't commit new experiences to memory. So those new incoming informational emails are just bounced and you end up feeling as though you're amnesic. You can't essentially make and create those new memories. We also know that a lack of sleep will lead to an increased development of a toxic protein in the brain that is called beta amyloid, and that is associated with Alzheimer's disease, because it is during deep sleep at night when a sewage system within the brain actually kicks into high gear and it starts to wash away this toxic protein, beta amyloid. So if you're not getting enough sleep each and every night, more of that Alzheimer's-related protein will build up. The more protein that builds up, the greater your risk of going on to develop dementia in later life. What are the effects of sleep deprivation on the body? Well, there are many different effects. Firstly, we know that sleep deprivation affects the reproductive system. We know that men who are sleeping just 5 to 6 hours a night have a level of testosterone which is that of someone 10 years their senior. So a lack of sleep will age you by almost a decade in terms of that aspect of virility and wellness. We also know that a lack of sleep impacts your immune system. So after just one night of 4 to 5 hours of sleep, there is a 70% reduction in critical anti-cancer fighting immune cells called natural killer cells. And that's the reason that we know that short sleep duration predicts your risk for developing numerous forms of cancer. And that list currently includes cancer of the bowel, cancer of the prostate, as well as cancer of the breast. We also know that a lack of sleep impacts your cardiovascular system, because it is during deep sleep at night that you receive this most wonderful form of effectively blood pressure medication. Your heart rate drops, your blood pressure goes down. If you're not getting sufficient sleep, you're not getting that reboot of the cardiovascular system. So your blood pressure rises. You have, if you're getting 6 hours of sleep or less, a 200% increased risk of having a fatal heart attack or a stroke in your lifetime.
The key point highlighted: good sleep equals better health. Without quality sleep, nearly every system in the body is affected, from memory and brain health to immune function and cardiovascular health. One specific sleep disorder is obstructive sleep apnea, OSA. There's a common misconception that sleep apnea only affects people who are overweight, but that's not true. It can be present in patients of all body types. Sleep apnea is often anatomical. When we lie on our backs, the soft tissues in the mouth and throat relax and can block the airway. If breathing stops for 10 seconds or more, sometimes 5 to 30 times per hour, it places serious stress on the body. As long as we are breathing, does it really matter how we breathe? All three of these examples show people getting air, but the way they're breathing is very different. And that difference matters more than most people realize. The way we breathe directly impacts our nervous system. Nasal, slow breathing activates the parasympathetic, rest and relax system, and shallow, stressed breathing activates the sympathetic, fight or flight system. How we breathe influences how our entire body functions. This short video explains how breathing, especially mouth versus nasal breathing, affects development, including the teeth and jaw.
The physiological way of breathing is through your nose. Breathing through the nose permits to purify the air by the structures inside the nasal cavity. In that way, the air entering into your naso- and oropharynx, your throat, is not going to heavily affect the lymphoid tissue in the adenoids and tonsils, which is the last barrier to catch harmful particles in the air before it reaches your lungs. Besides clearing the air from harmful particles, nasal breathing stimulates the production of gases and substances in the nose, which are going to facilitate the entrance of the air in the lungs and prevent infection in your respiratory system. Mouth breathing allows the air to pass directly into your throat, where the adenoids and tonsils are located. In that way, the air entering into your body through your mouth has not previously been purified, and the lymphoid tissue in the adenoids and tonsils become the first defensive barrier against the harmful particles contained in the air. As a consequence, that lymphoid tissue overgrows, occupying a large volume of your throat. That makes more difficult for the nasal breathing, and you make a habit of breathing through your mouth. In order to breathe through your mouth, your lower jaw has to come down, as well as your tongue has to rest on the floor of your mouth. Breathing through the nose is the correct way, and so the tongue is able to rest on your palate, stimulating a normal growth and development of your upper jaw. Conversely, when you breathe through your mouth, your tongue has to descend and protrude. At the same time, the pressure of your cheeks increases, pushing the upper jaw inwards. So the growth and development of your upper jaw is negatively affected, resulting in a narrow and high palate. The upper dental arch acquires a V shape instead of being a rounded dental arch. Therefore, your teeth do not have space to properly align. This also produces an incorrect swallowing function. Every time you swallow, between 1,600 to 2,400 times per day, the tongue positions low, staying away from your palate. That forces the tip of your tongue to position between your upper and lower front teeth. That pushes your front teeth to show out of your mouth, and your tongue resting on the floor of your mouth, with the tip of the tongue between your front teeth. That is called an open bite, as your upper and lower front teeth do not touch when you close your mouth. All those dysfunctions, mouth breathing, incorrect tongue posture, open mouth, and incorrect swallowing are going to continue affecting the growth and development of your upper and lower jaws. And as a consequence, there is less room for your teeth and they become crooked. Remember, the nose is for breathing and the mouth is for eating. Breathing through your nose and keeping your mouth closed with your lips together is going to help your upper and lower jaws to grow and develop better. But more importantly, it makes you healthier. Physiological way of
Let's
breathing.
break down a few key takeaways. Nasal breathing filters and purifies air before it reaches the body. Mouth breathing bypasses that system, overworking the tonsils and adenoids. The nose produces nitric oxide, which supports immunity and helps regulate blood pressure. Tongue posture matters. When the tongue rests on the roof of the mouth, it acts as a scaffold to support proper jaw development, and the way we swallow hundreds of times a day can affect tooth position and jaw position. Over time, these factors directly impact airway health, so the connection is simple. Nasal breathing leads to better sleep, which leads to improved overall health. The tongue also plays a critical role in how we breathe. During development, tissue under the tongue is supposed to release. When it doesn't fully release, it results in a tongue tie. Many people have some degree of tongue tie and don't realize it. Even mild restriction can impact tongue posture, breathing, and jaw development, which all affect our airway over time. Airway health, sleep, and dentistry are connected. Proper breathing is essential to overall health. An open upper airway allows oxygen to move freely in and out of the lungs, supporting the body's vital functions. When the airway becomes narrow or blocked during sleep, breathing can be compromised. Reduced oxygen levels place added strain on the heart and brain and may lead to serious health concerns. Your dental provider plays an important role in identifying airway issues. Because many signs of airway dysfunction appear within the mouth, dental professionals are often the first to recognize potential problems. Airway restriction can be caused by certain anatomical features, such as a small mouth or throat, an elongated uvula and soft palate, or enlarged tonsils or adenoids. During sleep, the airway may become further obstructed as the tongue and soft palate relax and shift toward the back of the mouth. Common signs of a restricted airway include crowded teeth, teeth grinding or excessive tooth wear, snoring, mouth breathing or inadequate nasal breathing, and obesity. When symptoms are untreated, ongoing strain on the heart and brain combined with poor sleep can contribute to conditions such as depression and anxiety, gastrointestinal disorders, chronic fatigue syndrome, fibromyalgia, and cardiovascular issues including stroke and high blood pressure. What's happening in the mouth often reflects what's happening during sleep. When the airway is open because of good tongue posture, we can breathe through our nose and get restful sleep. When the airway is restricted, we begin to see signs that are manifested in the mouth. Teeth can tell us a story about airway restrictions. Crowding often means the jaw didn't fully develop and can restrict the space where the tongue needs to rest. A scalloped tongue means the tongue is pushing forward in an effort to open the airway. Tori indicates one is clenching and grinding, which overstimulates the bone and causes bony growths. Tooth wear also demonstrates chronic nighttime grinding. And because the roof of the mouth is also the base of the nose, a narrow palate is associated with a restricted nasal airway. These clues found in the mouth help us ask better questions about sleep and breathing. Let's recap the impact of tongue posture and the path to better health. Our tongue posture as a child opens our airway and aids in the growth and development of our jaws and dental arch anatomy. This helps us have a healthy airway. Proper tongue posture as an adult leads to nasal breathing at night, improving our sleep and overall health. With modern technology, we can now take 3D scans of the airway and measure airway volume and surrounding structures in detail. These scans allow us to identify areas of restriction. When we create more space, by improving jaw position or development, we can open the airway and improve sleep quality. We also look outside the mouth for clues. Dark circles under the eyes, forward head posture, and facial asymmetry can all indicate breathing or sleep issues. Our airway exam includes a comprehensive head and neck evaluation, a thorough health history review, as well as photos of the inside and outside of the mouth. We take digital scans with a bite analysis and a 3D radiograph to evaluate all structures that influence the airway. This helps us build a complete picture and determine next steps, often in collaboration with a sleep physician. There are several treatment options in our office. Night guards protect teeth but don't address the airway. Oral appliances move the jaw forward to open the airway. Expansion devices help remodel and widen the airway over time. Early intervention in children can guide proper development. Additionally, we may recommend seeing a specialist to aid in tongue posture. Many of these options are non-surgical and highly effective. This story illustrates one of many patient experiences that have taken the journey towards better sleep. The patient came in exhausted, falling asleep quickly but waking up every night. He had been using a CPAP for years but still felt sluggish. After switching to a dental appliance within 3 weeks, he reported more energy, better mood, improved sleep, even dreaming again. His wife noticed the difference too. We often focus on diet, exercise, and heart health, but overlook something fundamental: how we breathe. Your mouth, teeth, tongue, and airway tell a story, and when we listen to that story, we can dramatically improve sleep and overall health.